Now, the final ligament that we really have to test at the glenohumeral joint will be the transverse humeral ligament for the biceps tendon. And we're going to use the biceps tendon itself to stress this ligament. So we'll bring the arm or the shoulder into about 45 degrees of flexion. And if I now make a contractor biceps, don't let me pull your elbow down, the biceps tendon will bowstring against the ligament. I can sensitize the test according to which side of the ligament I want to maximally stress. So if I laterally rotate this way, then when it contracts now, it will pull up here and essentially pull on the medial attachment of the ligament. So I'm not going to stabilize anything and just apply my force against and try to produce extension of an elbow and simultaneously of the shoulder. For the lateral band or the lateral lip of this ligament, I'll immediately rotate and do essentially the same thing again. Extend the elbow and pull it this way for the shoulder. And while I'm doing both tests, I'll palpate over the biceps tendon to see if I can feel this thing clicking in and out as it subluxes. This, of course, may be the biceps tendon that's actually tender and sore. So to rule that out, if we put the shoulder into full extension and retest, now I've got maximum stretch on the biceps, so the test should be worse in this position if it is a biceps, and there should be no pain if it's the ligament, because I'll be bowstringing away from the ligament now. So it's don't let me move you, and relax. And from those tests, we should gain an idea of whether we're dealing with a transverse humeral ligament inflammation or a biceps tendinitis. Of course, it could be both. Having tested the glenohumeral ligaments, the coracohumeral ligaments and the transverse humeral, we can look at articular stability.